Hello and welcome everyone. My name is Dr. Manickam and I'm a pediatrician. I went to Brown for medical school, Columbia for residency, and now I'm at Children's Los Angeles to specialize in the NICU. And today we're going to talk about sleeping during the first 6 months of life. So first off, in the first 1 to 2 months, babies typically will feed every 2 to 3 hours. And in ages 3 to 4 months, they'll feed every 3 to 5 hours. So it's only really at 6 months of life can you expect your baby to sleep through the night entirely. When they are sleeping at night in these first 6 months, make sure they're sleeping on a flat surface that's not inclined in any way, and there should be nothing on that bed. So of course they're sleeping in a crib or a bassinet. And when I say nothing else in that crib or bassinet, I'm talking about no stuffed animals, no blankets, nothing that can keep them from being able to breathe while they're sleeping at night. The American Academy of Pediatrics recommends that parents sleep in the same room where the baby is sleeping, in that crib or bassinet, but of course not in the same bed. This is just to make sure that your baby is able to, again, breathe at all times when sleeping. Sometimes when parents are very tired, by mistake, they can end up rolling onto their babies, or babies can fall off the beds, which is why we want babies to sleep on their own in a crib or bassinet. When they are sleeping in that bed or bassinet, they should be sleeping on their backs. There's something called SIDS, Sudden Infant Death Syndrome, that we try to avoid at all. It sounds scary, and it really is. One of the few things we know that can prevent that is having babies sleep on the back. That's not on their sides, not on their tummies. It makes sure that they're able to breathe at all points. Other things that can help prevent SIDS are pacifiers that you can let your baby suck on during the night, breastfeeding, and making sure they don't have any exposure to smoking at all. Many parents will swaddle their babies, which means taking a cloth that will wrap around their babies to keep them tight and feel like they're being hugged when they sleep. And this is totally fine. It helps babies feel more comfortable when they sleep at night. The one thing for you all to know is that when your baby starts to be able to roll over, which is usually above the age of 4 months, then you do not want to swaddle your baby. Your baby needs to be free when they're sleeping at night. Tummy time is something that you can do. I know I mentioned before that they should be sleeping on their backs, but during the day, when they're supervised by you, they can have tummy time. They can have up to 15 to 30 minutes of tummy time total during the day, every day, to help still develop their muscles so they can be able to roll over time. But again, at night, it should only be on their backs. For sleep routines, common questions parents ask, like we were talking about before, at 6 months of age is when they're able to sleep throughout the night, typically for the first time, without needing to be fed. Which means when they cry at night, usually to be fed or to have your attention at that age, the only way to really get them to start sleeping at night and throughout the night, to allow you also to sleep at night, is to just let them cry and self-soothe. Of course, after a period of time, if you're not sure if they're safe, or they're just not, they don't stop crying, then you might have to go in and check in on them. But if you're able to, over time, find out that they are safe, that they're just crying to get your attention or to maybe feed after 6 months of age, then that's a point in which you can allow them to cry, self-soothe, and they will learn how to sleep throughout the night on their own. It's important for their development and important for your sleep as well. With that, if you have any other questions or concerns about sleep, please email us. We're happy to answer more questions. And here are a few more points and clarifications for you to keep in mind as you listen to our videos. First, all the information that we share is for full-term babies, so babies greater than 37 weeks gestation and without any other medical issues. So if your baby does not fall within that criteria, make sure you talk to your pediatrician so they can tailor our recommendations for your child. Second, all the information that we share is my own clinical opinion and not related to any of the other institutions I've been a part of before or are currently. And third, for all the medical providers in the audience, if you have any other advice that you would like us to include, please send us a message. We're happy to try to include those things as well. If you find our videos helpful, please like and subscribe to our channel below and share with your friends. Thanks for watching. Take care.